Fatigue is actually one of the most common or the most common symptom of people living with orthostatic disorders. And the reason why I'm doing this sort of video is that it's not really talked about enough and probably one of the most confusing topics because we all know culturally the terms I am tired, I'm exhausted, I am worn out, I am kaput. But fatigue is actually like a medical term, which again gets back to I am fatigued, I am tired, I'm exhausted, I am worn out, I am kaput. You can use your own words to describe it. But fatigue is actually one of the most common reasons people go see a medical provider, a nurse practitioner, a physician's assistant, reach out to a nurse. It may not be the reason why people suddenly go to an ER, I am fatigued. It's usually a symptom that evolves over time, days, weeks, months, years, where people suddenly notice this departure of where I have been and where I am now. And what is fatigue? It's almost hard to describe. Sometimes it's actually easier to describe when you're suddenly realizing I am not tired. I feel well rested. Um, it's an experience. It is a physical experience. It's a mental experience. It could be a spiritual experience, an emotional experience, or an existential experience of overall encompassing of how you feel. So fatigue is something that we use as people to describe what we're going through, but can be challenging. Fatigue, sometimes as a person living with an orthostatic disorder, is probably best described as the challenges to get through your day. Fatigue can be just getting from a physical point from point A to point B. I have my hands crossed that way. And just being worn out, cannot do, running out of energy, your empty fuel tank. Fatigue can be just sort of losing your stamina, your energy, as if your body has a fuel tank like a car does, and you're just done and you're done. Your fuel tank is empty. And it's not as easy where you can just go to a gas station and just refill it. Sometimes rest can help. And fatigue can be very tricky where conventional models of that we use as people of sleep, elevating your legs, nutrition doesn't do the typical restorative manner of recovery of fatigue as somebody with orthostatic because there's a different mechanism due to the blood pooling of the orthostatic disorder. That's where we need different treatments of the hydration, finding the right way of getting the body moving through exercise, medications, salt loading if it helps you, health psychology to learn how to live with a chronic health disorder, right, good sleep hygiene, and everything else in the middle is biofeedback, wellness modalities, showing your body and your brain that you're okay, since the adrenaline response can sort of hijack your body knowing that it's okay at times, and ongoing care. But fatigue can also be this sort of experience in your head that you just feel worn out, this bankrupt, exhausted, depleted, empty feeling. And that fatigue does not mean that people are depressed or anxious, as that blah feeling that does not always equate to depression or anxiety. It can make you feel out of sorts, but it does not mean depression or anxiety. And often you can separate that out because people are fatigued, are still finding moments of joy in their life. They're worn out, but they find joy. They're still doing things in their life. They're still trying to persevere, versus people with depression might really be giving up, or anxiety where people are really under siege to the point where the thoughts are sort of eclipsing their ability to do things, where fatigue, that the true physical limitations are holding them back to do. It can be very tricky sometimes to actually separate out other factors, physically, mentally, fatigue from orthostatic, from other aspects. But that's sort of a description of fatigue. And it's important to at least hear it out because people are experiencing this, and often until they're diagnosed, it can be a very lonely, bewildering and isolating experience. I do recommend for people to listen to this video once, twice, three times periodically. Share it with people around you so they can get it and understand it, and that you don't have to explain it to them. That's coming from a physician. Um, it's a help along. It is the most common and paramount symptom, and ongoing care with your orthostatic treatments will help along over time. I appreciate you listening, and just listening to this video, listening to it periodically is part of this mission to help yourself. And I appreciate that. Thank you.